1 year ago, Queens shut down due to the COVID-19 pandemic. Since March 12, 2020, Queens has transitioned to online learning, closed campus services, implemented a testing center on campus, and experienced 2 lockdowns. The COVID-19 pandemic started making global headlines in January 2020. The pandemic was initially met with denial.
There were a lot of people who were and in many ways this is a typical reaction that humans have. They were very much sort of, oh well, maybe it's being overplayed and not a big issue. And I think people like myself who sort of know a little bit about infectious diseases and pandemic planning and stuff were saying, no, this is probably going to be a big deal.
The journal's first coverage of the COVID-19 pandemic included stories, "Students from Wuhan organized to send medical supplies home," published January 28, 2020. And former undergraduate trustee Tyler McIntyre's apology for attending the coronavirus theme party in early February.
A commonest thing I would oftentimes be asked is, well, how long do you think this is going to be here? And I remember at the time saying, if you're an optimist, maybe 3 or 4 months, and if you're a pessimist, probably 6 to 8 months. Lo and behold, here we are 12 months later.
On March 12, 2020, Principal Patrick Dean sent a university-wide email declaring that the following day, all in-person classes would be canceled, and the remainder of classes would be delivered remotely. According to Evans, the university faced major concerns of community spread due to the highly concentrated nature of Queen's campus and the university district.
The perspective university-wise was a real concern that it might take off within the university community because of the nature of the student body and especially the undergrads and residents.
Following the closure of the university, the Journal reported that Queen's canceled Spring Convocation 2020 on March 19th. The university later announced that all diplomas would be mailed to graduates, and that convocation ceremonies would be held virtually. Queen's gave students the option to declare winter 2020 courses as pass or fail, and on April 2nd, the first case of COVID-19 was detected at Queen's. On May 11th, the Kingston, Frontenac, and Lennox and Addington region was declared clear of all cases of COVID-19. The university announced that all classes would be held remotely for the fall 2020 semester. The AMS reported that plans for several services were up in the air. In July, Queen's made masks mandatory in all indoor public spaces. In August, the AMS Pub Services TAPS announced it would close for the 2020-2021 school year due to the COVID-19 pandemic, revoking several student job offers. Following a summer period of low case numbers in the Kingston region, community concerns grew when students began to return to campus. According to Evans, the return of students posed an existential threat to the community.
The city itself was very worried about what that impact would have, because at that point, as you mentioned, Kingston was pretty good. Kingston looked very, very safe. An outbreak that might occur, for instance, centered around the university and students would pose a really big threat, in essence, to the local surrounding community.
Amidst community tension regarding students returning to Kingston, the Journal published an editorial urging students to follow public health guidelines. Principal Dean noted that students would be held accountable if they were caught breaching public health policies, with expulsions being options for punishment. In September, Queen's opened a COVID-19 testing center on campus. Homecoming was held virtually, and the Kingston Police thanked the vast majority of Queen's students after only $880 worth of fines were issued. On September 22nd, Queen's announced the winter semester would also be held online. When the semester came to a close in November, Queen's had reported a total of 53 cases of COVID-19 in the student community. Following the Ontario government's announcement of a second lockdown going into effect on December 26th, Queen's urged all students to avoid Kingston until the end of January. On a global scale, reports of a new variant of COVID-19 were mentioned in the UK. In early January, Kingston experienced its first and only death due to COVID-19. Queen's Professor Emeritus Robert Pike. On January 12th, Ontario entered a state of emergency and a stay-home order ensued. KFLNA announced the first detection of COVID-19 variant B117 in Kingston. Following a number of parties on campus in the fall term, the university declined to comment on how students were being held accountable for breaking regulations. After announcing 2 homecomings would take place in the fall of 2021, the university backtracked on plans to have in-person homecoming celebrations. On February 10th, Kingston entered the green zone as the state of emergency and lockdown was lifted. AMS services gradually reopened, while Dean announced at the February Senate meeting that Queens was anticipating a full return to campus for the winter 2022 semester. On March 2nd, Kingston's vaccination center opened its doors at the Invista Center. During the week of March 15th to 21st, there were 36 new cases of COVID-19 at Queens, according to the university's case tracker. 4 cases were reported in residence, as well as 32 off campus, totaling 61 active cases in the university district. The university sent an email to students that Monday afternoon, encouraging anyone who's been in close contact with someone outside of their household without wearing a face covering or not physical distancing to get tested in the next 2 weeks, even if they aren't showing symptoms. As of Thursday evening, March 25th, 2021, Queens is reporting 71 active cases of COVID-19. When asked about what lessons he thinks the COVID-19 pandemic has taught Canadians in the last year, Evans noted that he hopes people are more empathetic toward each other.
The motto in the spring was, we're all in this together. And then as this has evolved over the last sort of 8 months or so, it's been more like every dog out for himself kind of idea. And I think we have to get back to that sort of concept that where we place our values in life. And then one of the biggest values we really need to look at is how we value our older citizens.